I am so excited to introduce our next guest, Lanier Rossignol. Thank you so much for being here today.
Thanks for inviting me.
Well, I've known you for years. I've been so inspired by your story, by you and your husband's story, actually. Can you tell those that are watching a little bit about yourself and why you're so passionate about helping families?
Well, I'm a family nurse practitioner, and when my own son started developing signs of autism, I had no clue until I went to a conference where a developmental pediatrician was speaking about autism, and I was like, I don't know, I felt like maybe something like that was going on with my son, and talked to my husband about it. He thought I was crazy. We talked to a child psychologist who was one of our friends, and because he was only 10 months old. He never looked at me. And then they laughed at me, and so we just kind of ignored it. And then I met another mom when he was 18 months old, and she was telling me about her son and how he hugged her, and it was like she was describing my son. Her son had autism, and she told me how to get him evaluated through the different programs in the state that we were in at the time. And once he got the diagnosis, my husband we were kind of surprised, actually, because he was pretty young. He was 19 months, and that was a long time ago. And that's how bad it was, because he's almost 18. And so his autism was so severe, it was really obvious to people in South Carolina. And I think they said only maybe they'd only diagnosed 3 other kids that young in the state before.
Wow.
And here I am, a nurse practitioner. My husband's a family practice doctor, and we kind of missed it. And if I hadn't heard that lecture at that conference, I would have never had a clue to even ask about it. And then I was pregnant with my second son at the time. My husband and I were in seminary. We were studying to be medical missionaries. We were looking at living in Africa. And so we knew, our dreams were of doing missions overseas were kind of ended at that point. And I remember I wasn't going to find out what sex baby I was having, but at the last minute I decided I wanted to know, and of course it was a boy. I'm thinking, I'm freaking out. And I remember this mom telling me it would be like winning the lottery if your second son were to have autism. And okay, so that kind of gave me slight peace, but I still tried researching. I thought I could figure out the cure and fix my other son before my other one was born, and just delved into research. And then my younger son, when he was born, he was completely normal. Unlike his brother, who was pretty much autistic from birth. He never looked at me. My younger son had great eye contact. He was very interactive. He was meeting all his developmental milestones. We even had him see the developmental pediatrician when he was 5 months old, just for that assurance. And unfortunately, 2 weeks after that appointment, he regressed into autism. We don't know why. There wasn't necessarily any trigger per se that we can 100% identify what caused him to regress. But it was devastating, and pretty much, I knew, even my relatives, my sister-in-law knew at Christmas time, and I could tell she was really upset. And I was like, I don't want anyone to know until after Christmas, and, made sure she didn't tell anybody. And but honestly, my children have been the most amazing gift from God. They've taught me so much about life and what is important, and they have changed my entire paradigm. I was traditional conservative medicine, and because of them and the medical community not having any answers for them, because with the standard therapies of OT and ABA, they were not making any progress. They had no speech. If you said, do this, they couldn't even do that. They had nothing. And with all that therapy after a year, and so I got led to talk to a doctor who was doing some alternative medicine with her daughter, and she hooked me up with an online support group of other similar parents. And so I wanted to try some vitamins and special diets that these parents were saying were helping their kids. So I talked to my husband about it. So he asked his other medical colleagues, who all said that was just a bunch of hooey and there was no research behind it. But he knew that what else do we have to lose? Because nothing else was working. And so he worked extra shifts at the urgent care to pay for these treatments. And so when we started doing it, they started to have some words. And we're like, there's something to this. And then I was able to convince my husband to go to a conference with me, and a medical conference on treatments for autism. And it was at that conference that he was just dumbfounded by the amount of evidence that there really was for the treatments. to hear these researchers and the scientists telling him about the studies that his colleagues had told him did not exist. It made him really frustrated and angry, and that led his passion to start doing research. While I stayed kind of at the home front taking care of my kids over the next 12 years, and as my kids got better over time, that's when I was able to go back and get recertified as a nurse practitioner, go back to work, and I joined my husband in his practice over the last 3 years.
And you guys are at Rossignol Medical Center, so if people want to learn more about what you guys do, it's rossinolmedicalcenter.com. Is that correct?
Yes.
Now, you and I have talked, and so many times people will say, oh, that's just because they have autism. They'll look at a behavior or a symptom of something, and you've had so many great lectures, and I remember sitting in on one of them, and you were talking about, don't just assume it's just because, quote unquote, they have autism. Can you elaborate a little bit on that?
Yes, there's a lot of things, and we see this all the time in our practice. I remember just with my own son going and seeing a GI specialist. He'd had diarrhea his whole life, and the doctor just said, oh, that's just autism. Did do no testing, nothing. So we didn't find a GI doctor that would actually scope him until he was like 12 years old, and he had ulcers and inflammation and dysbiosis, and it could have been identified much sooner had we had a doctor that was willing to actually look at him. And so we see that also in our practice, not just with GI issues, but also with speech. So parents wonder why their kids aren't speaking it, because autism really doesn't tell you anything about what's going on in the child. It just tells you about outside the kid. There's a speech delay, there's self-stimulatory behaviors. It doesn't tell you about the underlying issues. So some of our patients, the reason why they're not speaking is because they have seizures in their temporal lobes in the area of the brain that's involved in speech. And sometimes when you treat that with seizure meds, even in research studies, some kids will start to talk. That happened with my own children. And sometimes the reason why kids aren't talking is because they have an underlying mitochondrial disorder. So mitochondria are like the batteries for your cells. And so if the cells in your brain don't have enough energy to work the way that they're supposed to, then you may not be able to produce the speech. So it can be things like that, or cerebral folate deficiency. That's another one. We found in research studies about 70% of kids with autism, at least in the studies, have an autoimmune condition where their immune system is attacking the blood-brain barrier and preventing folate from getting into the brain, which is critical for neurocommunication, for development of the brain. And the research studies show that when you treat this from a early age, these children have a lot better chance. And we see it all the time in clinical practice when we treat it. Basically, we treat it with activated folate available as a prescription called leucovorin. So basically, you're saturating the bloodstream with so much activated folate that it gets in through another receptor that isn't blocked by the immune system, but it has to be in a high concentration in the blood. And a lot of kids start talking.
Wow.
And their speech becomes more complex. I saw that with my kids. I see that with patients. So sometimes it can just be something like that. Mm-hmm. And I feel like all these kids need to be evaluated. And cerebral folate deficiency is a treatable form of autism. Mm-hmm. And yet, I don't think general pediatricians have any clue how to even test for that. Or mitochondrial disorders. There's studies on that. Kids don't always necessarily have a true full-on mitochondrial disorder, but they may have mitochondrial dysfunction, and they can benefit from antioxidant supplements. Or we have kids that are going around their house beating people up, and it's because they're in pain. And what happens is doctors just put them on antipsychotic medications. The kids could have dental pain. They could be having migraines. They could be having constipation. We see constipation all the time in practice. We used to have parents that come in, and I made all these same mistakes myself, and that's why I'm so passionate about this. I had no idea my kid was constipated. He was potty trained, and then all of a sudden he started having diarrhea in his pants. So I'm thinking he has diarrhea, but he was constipated. He had a big stool ball that was plugging up his rectum, and just liquid stuff was leaking around that. And we had to, treat him with enemas, and, how long did my child suffer? And so that's why I'm so passionate, because I don't want these kids suffering, because they're in pain. And so, because when my son had aggressive behavior, he developed severe debilitating obsessive behaviors when he was 8 years old. And he started beating me up. If things weren't a certain way in the house, if he was blocked access to the pool, all these just different things, it was horrible. He didn't sleep. I had to buy like 5 of every toy because if anything broke, he was going to attack me. I had to clear out my whole downstairs because he would just throw lamps, and this wasn't my kid. And I was angry. I was so angry. I was like, we've sacrificed everything. We've gone in debt so that you can have a voice to tell me what's going on. And why are you doing this? And it wasn't his fault. It was a medical problem. And once we addressed that, he had pandas. He had gotten exposed to strep. And so once we addressed that, it took us a couple of years to figure out all these things. He started to get better. And now he's the nicest, most easygoing kid in the world, and he's just willing. Yeah, he has some mild OCD, that you kind of see with autism, but, if things in his schedule change, he's fine. He just goes with the flow. He's just this happy, amazing kid. And I am grateful that he's my son.
Well, and I think it's important for those that are watching, you and your husband are both medical professionals. And yet it still took you, as you said, a couple of years to figure it out. And I always think about that, when my son's going through something and I have access to people like you and your husband. And there's just so many great doctors out there now that get it. If you go to somebody who understands,
exactly.
Right? And I always think, gosh, that poor mom that might be somewhere that might be watching and she went to the doctor thinking that they are telling them the truth, and they're telling them what they know, but they don't always know everything. And so I'm thinking, I remember when my son was younger and he was having constipation and we took him to a GI doctor and he'd already been diagnosed with autism. And I think he was under 3 years old. And they said to us, oh, well, he's just holding his poop on purpose because that's what those that have autism do. And I knew at that time, that's crazy. That's just not true. And it turned out that he had celiac and some other things going on. But I think, gosh, what if I was that mom that just listened to the doctor and said, oh, it might be just because he has autism. And that's what I think that's so important. I think this, video that we're doing is so important for families to watch because I'm so tired of hearing, even in 2019, oh, it's just because they have autism. It's still being told. And I think it's important for those that are watching, as you said, it could be constipation. It could be acid reflux. It could be, pandas. There's some type of medical issue, and we got to find out the why.
Exactly. Every child with autism deserves a proper medical evaluation, just like anybody else.
Mm-hmm.
They may not be able to communicate, and as parents, we have to advocate for our children, and we have to continue to find doctors that are willing to help us. And sometimes we have to go out of our own state to find doctors. I mean, that's what I had to do. When we traveled to Florida, the first doctor that we saw, he had some different ideas that I wasn't really ready to listen to, and so we ended up going to practitioners that had children with autism themselves because I felt safer. At least they kind of knew. They probably had done that with their kids. And so that helped me. But there are a lot of doctors that are getting training now through MAPS.
And that's just for those watching. That's medmaps.org you guys can go to. That's medmaps, medmaps.org, medmaps.org.
Yeah, it stands for the Medical Academy of Pediatric Special Needs. And they're training doctors to try and help kids, treat kids integratively, look at their underlying health issues. Kids with autism and CP and Down syndrome and different genetic syndromes and other types of developmental disorders. And so I've just been amazed at how many people there are. Even in our community here, I'm learning about doctors that I didn't know about that may have options for my kids. So I mean, if they don't have the answer for you now, it doesn't mean that they won't have the answer for you later. Mm-hmm. I mean, some of my son's biggest progresses have been made after the age of 12 because we didn't know about mitochondrial disorders and cerebral folate until they were older, and they still had benefits. So it's never too late. Mm-hmm. I am still actively seeking treatment options for my kids, even at the ages of 15 and 18, because stuff is coming out all the time. They're publishing more and more, and you just have to keep looking. It's a marathon. It's not a sprint.
And so what are I love that saying. I actually just posted that today on my Facebook. I love that. It's not a marathon. It's not a sprint. It's a marathon, right? Because we always want it to be fast.
Did I say it the wrong way?
You might have, but it's okay.
I think I said it backwards. It's not a sprint. It's a marathon.
Yeah. But I think of all of us moms, we got it. We understand, and dads as well, I should say. But it's all of us want it to be really fast, you know,
It's not.
and it's not. And it's, I always think of it as that, you know, that book, The Turtle and the Hare. You know, I think of our kids as the turtle. We'll eventually be able to cross the finish line. We just have to be really patient. And, you know, more and more research is coming out, more and more studies are coming out. And, you know, my son is 16 and we keep learning more and more, and we can't give up hope. And for those families right now that are sitting there watching, and maybe they just got the diagnosis and they don't know where to turn, they're feeling helpless, they're feeling lost, what words of advice can you give them?
Never give up. Be your child's advocate, and just seek out doctors that are like-minded, that are willing to work with your family. And there's an amazing online support community. Finding other parents either in your local community or online through AHA, through TACA is another great organization where you can get all sorts of parent support information. And they have groups in your community. So when you have other parents to talk to, they're going to be your best source of information on who are the good doctors in your area and who are the best occupational therapists and speech therapists. So getting that network of people is
really important.
Really, really important.
You're not alone.
But don't always just compare yourself. Oh, you know, my friend's kid, his kid, he did this and now he's talking and my kid's not. It's hard.
Yeah.
Because our kids are not all on the same trajectory.
Absolutely.
But, you know, I never thought my kid would speak. And then he said a word. And then I never thought he would ever put words together. I remember dreaming once, in a dream, he said, pink rabbit. And I'm thinking, I'll never hear that until he's in heaven. And, I mean, he could, I remember just driving down the road back from the neurologist and telling me he wanted the song that was on the radio for me to put it on his iPad. He just stopped and went that song on my iPad. You know, I never knew that he could tell me things like that and make comments, and I just never knew. And so you just never give up.
Never give up, and it doesn't matter what age, and just keep on keeping on. And that's a great, great message, Lanier. Thank you so much for being here today and talking with us. And again, those that are watching, they can find you at RossignolMedicalCenter.com.
Yes, thank you so much,
Thank
Kristen.
you so much.
Thank you. Bye-bye.